Hello everyone, I'm back. This is Dr. Naina of NainaMD, Fusion of Science and Beauty, and I'm back with my guest. We're continuing a discussion with Dr. Ross on adrenal fatigue. So, getting back to that, I think one of the things is how you treat it.
Right.
And of course, lifestyle management, diet, and all what you were saying.
Right.
Correct?
Lifestyle medicine is huge.
Yeah.
Absolutely.
Where do you what else do you see as far as like nutraceuticals?
Well, as far as nutraceuticals, we need to find out what they're deficient in, and there's testing for that as well.
Yeah.
Again, more testing, but the accuracy and the validity of this in, looking at the white blood cells and nutraceuticals, what your deficiencies are, very important.
Yeah.
Now we're talking about genetics.
Yeah.
In genetics, we can find these markers as well.
One thing though I just kind of tell my patients is if just one thing that's going to feed the adrenals is pantothenic acid, vitamin that's B5, and pyridoxine B6. If you just do that, you'll get a little bit of adrenal energy, and add on a little rhodiola of 100 milligrams. Just give that a try. And vitamin C. We can't make vitamin C.
Right.
Vitamin C, we have to ingest it.
Right.
And a lot of people don't know that. So they go through the whole day without taking any vitamin C or without eating. Is that a good thing? No, it's not a good thing.
That's right.
Right?
That's right.
That's going to contribute to adrenal fatigue.
That's
and
right.
so how about just putting in your water, it's like berries or like drinking green tea. This and that, something that has a little bit of vitamin C, berries and even some orange slices. So it doesn't have to be all sugar, but it just could be just some natural sugar with the fruit. It's better than having corn syrup from all of the processed foods that you're eating.
That's right.
Even restaurant food, by the way, has so much processed food.
Absolutely.
It's the sugar.
Absolutely.
So why not just take water and put berries or oranges or fruit, and that's vitamin C, and you've just gotten your.
At least you got some dose of vitamin C.
Something.
The other thing that I recommend is vitamin D.
Yes.
People think that it's a vitamin. It's actually a hormone.
It's actually a hormone when
and
you look
it's
at
so
it.
important. Even us in California, we don't get enough vitamin D from the sunshine.
Well, when I was in
we
Dubai, when I was the Olay ambassador, and I was there for like about 3 years, and I used to see so many people, and they used to just tell me about their history and everything, and I said, did you get your vitamin D levels checked? They were like 10.
Yeah.
They were low.
Right,
In
right.
Dubai? Really? So, and I saw the same thing in Bangkok when I went to speak, and I would ask, same thing I saw in just all over the world. So whether it's somehow the something with the pollution or the ozone layer, or where maybe we just block ourselves too much.
Yeah, I think that's one of the big factors. We use these blockers when in fact a lot of these blockers are not healthy for you. And aside from that, we need sunshine. I tell my patients to get sunshine every day.
let's clarify the blockers, meaning the sunblocks.
Right, the sun blockers.
So basically a sunscreen is something that you have to keep applying every 2 hours. It's going to just go, okay? So that prevents the UVA, UVB, right?
Right.
But a sunblock actually reflects off. So those are zinc oxides. So just to clarify, probably a sunblock is probably better than a sunscreen. That's why women have all of these minerals, bare minerals with the natural zinc oxides and all of those that will protect them from the sun. Did you know, by the way, taking lycopene, I know we're getting off subject, but taking lycopene can really help with blocking of the sun.
I didn't know that.
And drinking green tea, your levels of antioxidants go down by 50% of catechins and CoQ10. So
it's good information.
This is the book. I'm going to I'm going to come to this book, right?
Okay.
I'm going to open it. Oh my gosh! So this is a set of how many DVDs?
There's 6 CDs. And
So
a
there's
DVD.
1, 2, 3 here, right?
Right.
And there is there's how many here?
There's 1 DVD inside the book.
And there's 1 DVD inside the book.
Right.
So that's a series. Is that 4 or 5? How many DVDs? 4.
One DVD.
Right.
There's 6 little snippets in there about different
I
conditions.
Got it.
Yeah, and then the CDs is the recording of the book.
Okay, and how can they get this book?
They can go to my website, which is drstephenross.com.
Okay.
drstephenross.com.
Okay.
And they can purchase it there. They can download it. They can do the download version, or they can actually get the hardcover.
Well, perfect. No, we'd love to. I've read this book. I mean, I've read the DVD. I've already read your book and the DVDs and everything. We all agree on the same things as a book, of course. But I want, tell me some of the interesting cases, or what is the most cases that you've had?
I think, I've had a variety just like you have.
Yeah.
And I don't specialize in one area, but rather healthcare for everybody. And
But they always say in functional medicine, fix the gut. It fixes a lot of things.
And yes, everybody in functional medicine looks at the gut because the gut is so important. Yeah. It's 80% of your immune system is housed there. Yeah. Our food is digested and assimilated there. Our enzymes mix up the food all the way down the track there. So it's really important that we look at the gut. And I had a patient a few years back. They came to me, and this was not an unusual story. I've heard many stories like this. Mm-hmm. But she came to me after 25 years of having gut issues. She'd had alternating constipation, diarrhea, mm-hmm. and she couldn't live her life. Is
that what conventional medicine classifies something, those kind of symptoms maybe as irritable bowel syndrome?
Irritable bowel syndrome, right. Exactly. So here's a woman who was a very highly functioning interior designer. She was a designer that would go around the world and really do interior design in super yachts. I mean, we're talking mega yachts all over the world. She loved that. That was her passion. For the last 20 years, she hasn't been able to do that because she didn't know how she'd feel when she's flying here and there. So I asked her a question. I said, 25 years ago, what happened 25 years ago? And she's thinking, and she says, oh, I got married. Now, most people laugh at that and go, oh, well, there you go, there's the answer. And I said, okay, so 25 years ago you got married. Did you go on a honeymoon? She says, yes. I said, where did you go? Where do you think she went?
Mexico.
Mexico. I said, did you get sick there? She says, yes. But I came back, my doctor gave me the Lumodal and antibiotics, and I was fine after about a week. I said, were you?
Did you check parasites?
And she says, no, I wasn't. Because 6 months later it came back again. And I said, what did you do? She went to the traditional GI doctor, and he did a stool test.
Did you check her for parasites?
He did a stool test.
Yeah.
Now here's the
Doesn't always
key.
pick up, yeah.
I said, was it a one-day stool test? She says, yeah, as far as I know. I said, there's the mistake. She says, what do you mean? I said, we need to do a 3-day stool test.
3-day stool test.
Why? I said, because there we're going to pick up things like parasites, bacterial overgrowth, yeast, fungus, and maybe even what's called H. pylori, because H. pylori sheds every 3 days. And these parasites are smart. They're little animals, and they're smart, and they can burrow their way into what are called the villi. So she agreed. We did the test, and wouldn't you know it, 3 parasites showed up. Not 1, not 2, but 3, in addition to Helicobacter pylori. So I said, okay, you've got an alternative treatment here. You've got 1 or 2 things you can do. You can go the traditional route and use what's called a Prev Pack, which is antibiotics and Prevacid. Or we can do it a natural method with botanicals. I said it takes a little longer, but it's safer and more effective. She voted for the botanicals. I was happy with that. I got her supply, and we retested in 90 days. Now here's a key part of what functional medicine practitioners do that traditional don't, is we retest.
I know.
Don't you want to find out whether your treatment was effective or not in any case? Yeah. And the answer is yes. So we retested. Well, those 3 parasites are gone, but guess what? 2 more showed up that weren't evident the first time. So again, we went through the cycle. We did this 3 times. And over about a year period, and it does take a while when we've got an issue like this.
When you've had gut issues for 20 years, it's going to take a while. It takes a while.
So we figured it all out. We went through all the treatment, and she was clear. And after a year, she said, I have my life back. Yeah. Thank you. Yeah. So and that's not an unusual case.
It's not unusual, I know. I've had cases like this all the time where people have had issues for 20 years and suddenly we find out, it's adrenal or it's a thyroid or it's this, just because we looked at it a little differently. Right. And tell me, what do you get a lot of? What's a basic in functional medicine? The basic gut healing regimen is, we say, are generally fish oils and probiotics, and we even define that further. So I think the audience need to know, because there's so much information and misperception coming about fish oils. First of all, fish oils can have mercury in it. After all, most of the fish oils, they actually, if you go anywhere just at the supermarket to get them, you need to know, are they mercury free? Then you need to know, again, another marketing trick is it mercury free in parts per billion or parts per million?
And also where the fish comes from and what kind of fish it is.
And also, if they're glycerol derived fish oils, it will get into the cell more readily, or phospholipid derived. Otherwise, if you consume a fish oil, it just turns rancid. And seriously, if you can't digest it, Where's it going to stay?
Well, and the important thing that you and I both understand, and those that practice functional medicine, is there is a difference in the quality of the supplements that we prescribe that are specific pharmaceutical grade that only practitioners can get, as opposed to what you can get at the the health food
that goes
stores.
back to nutrigenomics. Really, is actually aligning yourself up and really acknowledge it. So I wanted to give that as a little example because we study every little thing as so important as drugs.
Right.
You know, that's why it's nutrigenomics.
And you were talking about probiotics, and I don't think
even the proper kind of
I don't
probiotics.
think people realize that there's over 100 different strains.
I actually
probiotics.
have in my prescribing thing. I prescribe over probably 50 different probiotics and different mixes depending on who or what condition. And they just say, oh, take a probiotic. You know,
or eat yogurt.
Yeah. I know we're getting towards the end of the show, but one of the things which is amazing for omega-3s, and that's fish oil, is that chia seeds. Chia seeds are great. I often take drinks at the health store that have chia seeds in it, and a certain amount of sugar, which is in a sugar form, not a corn syrup form, is okay, because when you get up in the morning, your brain needs glucose. When you go to the hospital, you get an IV fluids, and that's a lot of it is glucose. It's so sugar is not bad by itself. It's when it's processed. It's when it's corn syrup, when it's modified, genetically modified. And beet sugar, by the way, that's one of the most common genetically modified sugars.
Right.
So cane sugar tends not to be. So we have to be careful about even genetically modified foods that are hitting our gut now.
And that's why it's important to seek out a physician like ourselves. If you're a vegetarian, you don't want fish, there's alternatives. Like you said, chia seeds, flax seeds are very good.
And then the other thing too is shelled hemp seeds are amazing. So those are
alternatives.
There's alternatives, So again, this is just an example of a discussion that we often go through as anti-aging regenerative physicians, functional medicine physicians, to really gain knowledge and understanding into our patients' metabolic imbalances, you know. And I mean, I love biochemistry. I could talk all day long on this, and that's why I still feel my show is too short at half hour. Because I could really go on for hours, but I do at night.
But you're unique, Dr. Naina. I mean, you do understand biochemistry more than most physicians out there. And when we're talking about functional medicine, that's what it is. It's understanding biochemistry and understanding physiology, getting back to the root of our medical textbooks, isn't it?
Yeah, that's what I did. Guyton's Physiology and our biochemistry books. Thank you so much, really. It was a pleasure having you on the show. We went everything from adrenal fatigue to gut and to talking about diet, right? And it's all part. It's just in a day's job for us because it's just what functional medicine is.
That's right.
Yep.
Thank you for having me.
Again, well, thank you. And again, where can the audience look you up? It's
drstephenross.com.
drstephenross.com, and then also you have the advancedmedacademy.com if you want to learn about it. Right? Some curriculum. Okay.
Great.
Thank you, everyone. I'll see you next time, next week. Dr. NainaMD, Fusion of Science and Beauty.